Hey everyone, it's Josh Gutman here, and I wanted to tell you about a case that I had recently. So it's a morning shift, it's about 7 a.m. I'm walking into my shift, and as I walk by the resuscitation room, I see a large group of people. So I put my stuff down and I go in to see what's going on to see how I can help and get the overnight team home. So I walk in, and the residents were really excited to see me. They're like, "Dr. Gutman, you're here. Amazing." And of course, I think, hey, it's going to be something ultrasound. So one of the residents looked at me and said, "We just put in a central line, but we're not sure if it's in the artery or the vein. We sent off some blood gases. Can you help?" So I said, "Of course I can help." So this was a line that was placed in the IJ, and the blood was a little bit more red than they would have expected. And so they were sending off some blood gases to see if it was in the artery or the vein. And so how can ultrasound help with central line confirmation? First, you can just look at the guide wire or the catheter if it's already in and see that it's going through the vein. But another cool way to do it is to do an agitated saline study. So this is what we did at the bedside. What you do is you take a flush, a 10 cc flush, and then you inject it really quickly. And then if you see almost immediately that the bubbles and flow into the right atrium and right ventricle, then you know it's got to be in the vein. So let me show you what it looked like. So I'm going to show you a subxiphoid view. Now this patient was very large, so it was very difficult to get cardiac views, but I was able to get a decent subxiphoid view. And when I play it, what you're going to see in the right ventricle over this 3-second clip is a flush of fluid going right through. And so just prior to this clip starting, the resident injected some saline quickly, like flushed it very quickly, and then you can see there, right there, you may have missed it, it's very quick, but look over here. I'm going to play it one more time. As it gets flushed, fluid going right there through the RV very quickly. And so if you see that within seconds of the flush, you know the central line is at least in the venous system. Here it is in slow-mo. And there it is. So this is that fluid right there, right into the right ventricle in the subxiphoid view. And hey, this is at the right place. So if you didn't know that this is a way that you can confirm that the central line is in the venous system very quickly, that's a way you can do it. And what's really nice about this is you don't have to wait for results to come back. You don't have to wait for x-ray. You can have someone put the ultrasound underneath the drapes and get this view and do it really quickly in real time. This is just another example of how ultrasound is awesome, and it's really helpful at the bedside. Use it, try it out if you haven't done it before. It's really cool.